President's proposed budget would substantially increase the deficit. Pennsylvania doctors also fear it might cut low-income access to health care.
Those cuts brought pediatricians to the Capitol today, not with a prescription, but with a warning. Mallory Metzner joining us now live from the state capitol. Mallory.
Valerie, Alicia, those pediatricians said that Medicaid covers 35% of Pennsylvania births. In addition, it covers routine preventative care, dental and vision screenings, even speech therapy in schools, and mental and behavioral health needs. Now, there's a lot of uncertainty about how access to that care would be affected if federal cuts are made. Dr. Priscilla Posse says Medicaid kept her sisters healthy and in school.
My sister was still able to have her asthma medications on time and play basketball at a high level.
But the Pennsylvania chapter American Academy of Pediatrics says proposed federal funding cuts in H.R. 1 is a threat to the more than 1.4 million Pennsylvania children who rely on Medicaid or CHIP for their health care.
We certainly understand the importance for fiscal efficiency and responsibility. The first responsibility is to the health of our children.
The White House said in a statement Monday, Medicaid will be strengthened if those in the country illegally are removed from it. Since Medicaid is jointly funded by the federal and state government, Dr. Posse says cuts on the federal side shifts the cost to the state.
So our concern is that funding may be shifted away from healthcare services or away from education, away from transportation, away from funding our police and fire department.
Another issue causing confusion is COVID vaccine recommendations. RFK Jr. said last week that healthy kids shouldn't get it.
The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
I think it's a parent's choice whether or not they immunize their child against COVID, and to take away that choice is unfortunate. So I'm glad that the CDC decided to making for the COVID vaccine, and so they actually did recommend that children, all children, get the vaccine in consultation with their pediatrician.
Dr. Tony Richards-Rowley says the COVID vaccine is important for pregnant women and children under 2.
Those are the ones who are at increased risk of ending up in the hospital.
These pediatricians worry about kids' access to all vaccinations if cuts are made to Medicaid. The U.S. House passed the One Big Beautiful bill in May. The Senate still needs to consider it before any of those cuts would be final. Live at the state capitol, Mallory Metzner, ABC 27 News.